All right, it's time for us to talk health. And to do justice to that is Dr. Opeyemi, a medical doctor currently doing a specialty training in community medicine and primary health care. And she's here to discuss could polycystic ovarian syndrome lead to infertility. Such a pleasure to have you here.
Thank you for having me.
Now, when people talk about PCOS, which is generally what we call it, most people don't even really understand what it is they're suffering. They just know, oh, it's PCOS. Tell us more about it.
So PCOS, let me break it down. Polycystic Ovarian Syndrome. So first of all, poly means many, and then cystic means that there's a cyst somewhere. Cyst is like a big balloon filled with water, particles, air, various things. Then ovarian, that means it's in the ovaries. And then the syndrome means that it's a combination of signs and symptoms. So when we talk about PCOS, we talk about four basic categories of these signs and symptoms. The first one has to do with the menstruation and menstrual cycle. So we have things like anovulation or reduced number of ovulations for the whole year. Then we have the metabolic syndrome, which means that they're predisposed to things like hypertension, diabetes, that's in that category. And then we have the multiple cysts in the ovaries, which is seen when you do the transvaginal ultrasound scan. And then you also would have another thing which would call, when we say PCOS, we talk about androgens. That's the male hormone is being produced at a more excessive rate than it should be for a female. So we have that hyperandrogenism. So we see signs like hairy components on the body of the female. So places like the abdominal areas where you shouldn't see hair there, hair, you know, on the beards, just, you know, forming very airy, really. So when we talk about fertility, we're looking more into what are the factors that predispose them to having, you know, a higher risk for infertility. And first of all, like I said, there's an issue with the menstrual cycle. So some of them do not ovulate at all, while some have less than 8 cycles in a year. So that means that they have reduced chances of having a child because they're not ovulating. Do you understand? And then another thing that could happen is because of this increased level of androgens, so they do not even allow the ovaries to act like a female, you know, ovary. So that's really what happens. It's not that they cannot have children, it's just that there is a journey to ensuring that the ovaries kickstart and start to, you know, ovulate. And the more the ovaries ovulate, the more their chances of, you know, having a kid. Okay,
this one you spoke about the ovaries and all. I'm sure scientifically there are ways to jumpstart that right now. Okay.
Hormonal therapy is a very good way of doing that. Usually what is being said is when a diagnosis is being made, then you have to work with your gynecologist. It's a process. It's not a one-time consultation type of thing. It's something that continues over time. And what they do is they give you an hormonal kickstarter. And then once you see your menstrual period, there are also investigations that, you know, you would do. Because there are some investigations that have to wait till you see that period to be able to do them. So they look at hormonal profile. So they check for things that usually happen in a normal menstrual cycle. So the follicle-stimulating hormone, the luteinizing hormone is looked at, prolactin is looked at. We also look at the thyroid-stimulating hormones and see all these hormones and see where are they, what level are they, how can we continue from there. Do you understand? So when the woman sees her period, then there's that continuous journey to ensure that she's ovulating every month. And then they calculate your days when you're ovulating and you're expected to meet with your partner when you have that happen.
But what are the causes?
The thing is, there's no, science won't tell you this is a cause, but they'll tell you there are risk factors. So one of them is genetics. So if there's a family history of PCOS, then there's that possibility that, you know, the first generation would also have PCOS. Another thing is early menarche. So for example, menarche is the first menstrual period a woman would ever see. So if you see the very early,
like 11 or 10.
Yes, and then there's what we call the pre-puberty stage. So normally puberty ranges from 8 and that. So, but if there's some people that have seen their, you know, puberty starts for them 6, 7. So that's another risk factor as well for them. Another thing could also be things like androgen. If the mother, while she was pregnant, used a lot of androgen-containing medications or something like that, that could also lead the child
What kind of medications contain androgen?
You know, androgen is a male hormone, so for sportsmen and sportwomen, because they're trying to increase their, you know, effectivity, and, you know, there's that possibility of...
But there's no residue. Say, for example, she probably stopped, say, a month or two before trying.
Well, there's still the science of that. There's still the research of that.
On that, okay.
Another thing is medications for seizure disorders have also been shown to also be a risk factor for PCOS. So it's just risk factors. There's no...
It's still something that is undergoing research.
Yes, as regards the cause of it.
Oh, wow. Okay, so we've talked about the cause, we've talked about some of the effects. Of course, we should also talk about ways that it can be managed and controlled.
Yes.
Unfortunately, we do not have enough time to do that. But we'll see. What we're going to do now is we'll just touch on them quickly.
Okay.
Yes. So
now,
yes.
Okay. So lifestyle modification. Remember, I talked about the possibility of metabolic syndrome and then high blood pressure, diabetes, obesity, and all of that. So lifestyle modification, reducing salt intake.
Really?
Yes.
Okay.
That would, where salt goes, water goes, increases your blood pressure. So one of the things we say for managing blood pressure, reduce your salt intake.
Okay.
So next would be lots of water, fruits and vegetables, the right sources of nutrients, run away from fatty foods, junk foods, and all of that. So ensure that your diet is on check, do you understand? And exercise to also help to deal with that. Then the next one would be ensuring that whatever you see, look at your period very well. What's the blood looking like? What's the volume of the blood? Is it regular? Is it irregular? So all of this will help you in your discussion with your gynecologist. And then run away from anything that contains androgens and try not to be that person that uses it so much.
So there's a quick one I just have to find out. It has to do with irregular menstruation, which you mentioned. There's some ladies who can have their periods twice a month, and then probably wouldn't have any for the next 2-3 months, and then is that also...
It's very important you know your menstrual cycle, and the best way to do that is the first day of one bleed to the next first day. So count the number of days between it and do that for 3 months. That gives you a rough understanding of what your cycle is like. Then from there we can tell if it's in the right scale, the wrong scale, and then we can do something about it.
Thank you so much. This has been really, really an eye-opener. Thank you so much for your time, Dr. Opeyemi. All right, we'll take this break. Wake Up Nigeria continues in a bit. Stay with us.